the recording. And we will start with the intrarenal disorders over here. Very important. The presentation that I am doing tonight is a little bit more extensive from with the PowerPoint that you already have. I like to do this because I like to go in details with this particular chapter because it's extremely important for you in the healthcare setting. One of the slides that nobody possesses is a slide that I will show you now. This is an interesting summary about all the functions of the kidneys. Instead to be jumping back and forward in your books or in your PowerPoint, this particular slide summarizes one of the most important functions of the kidney. Filter the blood plasma, separate the waste from useful chemicals, return the substance to the blood, eliminate the waste, regulate the blood volume and pressure, the osmolarity, renin, erythropoietin, the acid-base balance of the body fluids, the famous calcitriol that many people don't understand that is still vitamin D, and even in extreme exacerbation, the kidney can do something very important for you, and is the production of glucose using proteins, and that's what happens in the extreme cases scenario of starvation, where the body will try to basically survive using whatever resources they have over there. Meaning that this is on a slide that I will take my time. I will leave it over here a little bit. If somebody want to take pictures of it, because it's very important, can help you out to speed in the process of a study. Meaning that before I move to the second one, and you're still here, so you have it in the PowerPoint? Perfect. That is better because that means that I can go to the next one over there. Perfect. Meaning that I send the newbies. Perfect. The next one is a question that I always like to do to everybody. If you remember this question in the audience, please keep quiet. Let's see if the persons of this term can tell me which particular kidneys is this one. Is this right or is it left? You can send the beautiful using the beautiful chat and tell me if you think that this is the right kidney or the left kidney. Let's make a votation. Who said that is right? Who says that is left? Everybody's saying left. Wow, actually say that is right. That is amazing. I love it. I love it. I love it. Left, right, left, right, left, right. Well, I have something for you. This is an spleen. It's not a kidney. I always do that to show you how much we know about anatomy and physiology. Almost nothing. Yes, I know that I'm sneaky. That is my beautiful way to live. Sneaky, sneaky like me. But you see over there, Modley, I hope that you like this one. I know that you was waiting for something like that. But that is an spleen, and the spleen is very similar to the kidney. And that's why I always put this picture out. But I will go to the next one and show you what is the gross anatomy of the kidney. You see over here, you have what is basically the cortex, this area over here, and everything in that area that is dark is the medulla. Obviously, you had the famous renal pelvis over there, where basically the final product is reaching from those areas of the cortex and for those areas of the medulla, that is the urine. It's interesting to notice that over there, many people confuse that particular vessel that you have over here with some arteries. No, this is the beginning of the ureterus over there. Okay? Meaning that you see over there is a complex structures over here. Everything that you see like this, very big, is what we call a pyramid. This area over here have a huge concentrations of nephrons. Those nephrons that live in that areas of the cortex are the ones that are called the cortical nephrons. There is other nephrons that goes all the way into the medulla and return back up, and these ones are called the juxtamedullary nephron. I will explain a little bit more later, but that is why I always put this picture over here to give you a glimpse about how a kidney looks over here when we split it over there in two. Let's move on to the next one. Exactly what I mentioned in the class. We have the intrarenal disorders over there. I did some extra changes. Believe it or not, I decided to put some kind of extra uses in the particular quizzes. I have some particular question. The majorities of the question will come from those last three categories that you have over here, but I still put some questions that belong to the neoplastic condition. We will see them soon in this particular PowerPoints and probably in the next chapter also. We mentioned pain. Exactly what I mentioned before. I have some true or false about this one, meaning careful with the first two. The only problem is that I decided to concentrate more in some particular diseases that affect the ladies, and that's why in this particular category, you will see just one particular question in four tests, and it's a true or false. You will see that the last two particular chapters of those topics that we are covering this week need to deal a lot with the ladies and some manifestations related to the menstruations and another abnormalities in the obviously urinary system, and the same thing for the gentleman, meaning that the last two chapters from these particular topics cover most of the areas of the reproductive urinary system. That's why I want to leave it for tomorrow. Moving on over here. Abnormality finding in the kidneys, believe it or not, I decided to remove this one out. Most of us already know, we have an idea what's going on over there when there is an abnormalities in the urine. You see something that is not yellow or completely transparent, it's because we have something over there going on. Meaning that is the reason that I decided to remove this one out. The QB, this is another particular thing that I decided to remove away this time, meaning away from this one. But remember, this is something that you will see several times in the hospital. You will need to deal with these kinds of initials and these kinds of way to think in the hospital. Remember that we have our own language when we are working in the hospital. And if you don't become accustomed how to use this particular language, you will be a little bit lost in the beginning. Again, I will eliminate this one out. Forget about the questions, obviously. And then we have some congenital abnormalities, but as I told you before, I didn't ask you anything of the congenital abnormalities, meaning that you can remove this one out. That doesn't mean that you will see some of these cases later on in your life. There is some of them that can show up, especially the first one, that the kidney do not develop in the baby. That is a critical problem sometimes. I have situations in where the newborn have hypoplasia, and imagine a baby with a kidney that is not well developed, all the problems that he can get, especially if I'm referring to you to the first slide that I showed you tonight. All those particular functions in the kidney in that newborn could be completely out of whack, meaning that this is a kid that probably will need to be under observation for a long time. Again, I will not ask you for that one. The cystic kidney diseases, also I decided to remove it away. See, I start the chapter with the way that many people like, eliminating a lot of the slides. The cystic kidney diseases over here, there is one particular question. There is a multiple choice over here, just one. This is the only variant that I did in this particular one. Careful with this one, is my typical multiple choice. Everything belongs to the cystic kidney diseases, autosomal recessive form, except I will change something over there, but it's only one of four just to make the difference, test a little bit different between themselves. Remember, multiple choice over there. Autosomal dominant types, forget about this. You will deal with this one later on in your life. But again, I want to concentrate to something that you will see commonly in the clinical setting. Again, out. And then we are reaching the neoplasm that basically is the second main category over here. In the benign renal neoplasm, I did some changes. I will ask you for something. But in this particular slide is another one that I will ask you, meaning out. The renal cell carcinoma, careful with this one. There is just one question, multiple choice. Careful with this one, exactly like that. Everything is true about renal cell carcinoma except I will change something from there. Okay? This one I will give you as a freebie. This question is coming, but it's coming like a true or false in two tests of four. And you ask me what is the part of the PowerPoint that is coming in the true or false? Concentrate in the first two bullets. Okay? But it's a true or false, and two tests of four will have that true or false. Careful with it. Moving on to the next one. Infections, I did this question. You will see this question in two tests of four. It's a multiple choice also. Very simple questions. I try to help you out with some of the questions. Try to make something very silly that is evident that cannot be part of the answer. But again, see the people don't watch the videos or they are not studying, even the most silly answer can take you out of guard over here, okay? Meaning careful with this one. It's a multiple choice. It's two of four in the test over there. In this one, I decided to remove it out. Acute pyelonephritis, this is a question that everybody will see. Meaning everybody need to know about acute pyelonephritis because I will put it over there. Meaning there is some variance of this question. This question in particular is very similar in all the four tests over there, meaning that you need to know this PowerPoint also with the next one. Okay? Because that is part of the question. I will play with this question in the different tests, but it's the same topic about acute pyelonephritis. Meaning, if you know both slides, impossible for me to trick you out. Okay? Moving on to the next one. Forget about the questions. And then we have chronic. Chronic, exactly what I told you. Another, this one is 3 or 4 because I did some changes also, but goes with the next slides too, and it's a multiple choice. It's the same thing that you saw until now. Everything is true. What is false about chronic pyelonephritis, except blah, 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 ABC, and continue with the next one that is part of this particular question. Meaning again, multiple choice, 3 or 4. You already have at least 2 questions that everybody will see no matter what. Plus the Wills tumor that I think that is will be number 3. Obstruction, yes, I will do a questions about obstruction, but it's not this one. I will show you which one in particular will be. There is some particular question that I subtract some of the things over here, but this is not a question. It's I am using those particular sub-bullet to make some particular questions later on over there, meaning that I will put an I over here saying that careful with that to make sure that you review these slides to avoid to become confused with the question. Now, careful with this one. It's a multiple choice, 1 of 4. Very simple for me. Complete obstruction resolving everything except, and then I will change something over there. This one, everybody will see it. 4 of 4. Everybody needs to see nephrolithiasis because that is the most common thing that you can see in a renal patient, that beautiful renal stone. Obviously, I will include something else from the next slide to make the bullet completely over there, meaning that these 2 slides do the multiple choice and everybody will see nephrolithiasis, okay? Remember the composition. But basically, it's the 2 slides doing the multiple choice over there, exactly what I do. Everything is true about nephrolithiasis except blah, blah, blah. This one in particular, I didn't ask you for this one. I didn't put anything from this one. You can eliminate this one, just the previous 2 for that question. I will jump over here to the next one, and then we reach the glomerular disorders. The glomerular disorders in this particular one is basically an introduction. That's why I didn't ask you anything from here. The classification, careful. Exactly what I told you in the class, careful with those two lines over there because there is a true or false with them. But it's just 1 in 4. Moving on immediately to the classification, somebody will see this question. It's 1 of 4 multiple choice. This is the different classifications of glomerular disorders, and I did all of that except something, meaning that I will change something in size of these fellows because it's very easy. A, B, C, D, and E, or all of the above is true, all of the above is false. But it's a multiple choice about that one. In the size of the deposition, forget about this one right now. And then we have the famous nephrotic syndrome. Nephrotic syndrome over here, we have a slide that goes deeper than this one over here, and is the one that I would use to do my multiple choice. Meaning, I will not ask you this one in particular, because when we reach the nephrotic syndrome, I will tell you exactly what is the slide that I want. This one, glomerulonephritis, yes, this one is coming with next slides too. Because you had the acute glomerulonephritis. This one, basically, you will see it with the previous one also in 3 or 4 tests, multiple choice. And the reason that I am very specific is because, again, I have the tests in front of me. I'm watching them in my other beautiful iPad. Careful with this one. This is the other one that complete that question. Again, multiple choice. The next one, the post-infections acute myelonephritis. I did this one just for one test, multiple choice, just to make it a little bit different between themselves and avoid that lazy eye in some people over there. I checking my count. It's very interesting. We only have 47 students. Wow. Online at this moment. Moving on to the next one. This one, I told you that I will put it, and it's true, it's there, meaning 4 of 4. Everybody will see this question. Multiple choice. Acute glomerulonephritis. Yes, when I reach over there, I will show you what I mean with that, Maria. Right now, just slide over there because I need to show you when we reach to that areas of the disorders. Again, multiple choice, careful over here. This is something that I like to ask over there. Always very important because it's the most common diagnosis in commons in adults over there. That is the reason that I need to ask you for this one. This is another question that is coming, but this one is 2 of 4. Multiple choice, and obviously goes with the next one to complete the multiple choice. Sorry. What I did was I break the sentence to create the multiple choice. That's what I did. But this is one question in particular, meaning everything is true about Goodpasture syndrome is an autoimmune disorder. Combinations of the glomerulonephritis with alveolar hemorrhage. Antiglomerular basement membrane is another particular thing. Shortness of breath could be another option. And hemoptysis like a separate option inside of the multiple choice. That's what I did. But it's coming. And again, this one over there, I think that 3 persons will see this test. I would say, yes, 3 or 4, we will see this test. 3 or 4, multiple choice. Chronic glomerulonephritis is also there. 3 or 4, multiple choice. Okay. Moving on to the next one. This one is also there, multiple choice. But this one is 2 or 4, multiple choice. It's exactly like that. I copy paste the slides and then I change something inside of these particular bullets. There you go, the nephrotic syndrome that I mentioned before, and everybody will see this one, no matter what. Okay? Everybody will see these slides, this question. Now, again, when I do that, don't signify that everybody will have the same answer to the question. Everybody is getting different answer for the question, meaning you need to pay attention to everything that is there. And please make sure that the answer don't make sense. That is important about this. Meaning, if it's a nephrotic syndrome, and even that I said increased glomerular permeability of the proteins, what that means that that permeability inside of the nephron is impaired and is allowing the protein to escape inside of the urine. That is what that means. Make sure that those numbers 3.5 is correct. That you have proteinuria, that you have hypoalbuminemia. All these particular concepts need to be important that you review them every time that you study that makes sense with the pathology that you have in front of you. If I change something very simple, like a decrease in the liver activity can cause hyperlipidemia, hypercoagulability, that makes sense. Make sure that I said increase, not decrease. This is the kinds of thing that you need to follow in the PowerPoints. Moving on over here. This one in particular is out because the question is with the previous one. And this one is also there. It's 1 of 4 that I decide to do also multiple choice. Okay? Again, careful with this one. And believe it or not, chapter 27 is gone because this is everything that I will ask from here. Meaning I will start the recording.